Friends, my name is Krish from Canada, and today I just want to present to you some of the facts and figures about this COVID 19 epidemic that is happening all around us and how it is impacting our life and life of the people who are probably losing their jobs, and some of the summary points way forward, like what is the good direction that the country should take for US and Canada both. So I want to draw to your this is the present situation as of like 18th of March 2020. So altogether there are about 194,900 cases reported with 7,876 deaths. So I just kept these figures into like a summary form just for comprehension. So the epidemic, as we all know, like it started like in China. This was about like the third week of February, and then it almost like finished by the third week of March, when the rest of the world started taking over. So these orange are the rest of the world other than China. So this is the breakup of this rest of the world figures. So most of the cases were like in Italy, this yellow portion. The gray portion is like in Asia, and most of that was like in South Korea. And this from about like 6th of March, then some cases started coming in US, this orange portion, and that is when the real scare started, and daily media are giving us some false informations. So just to think like keep things in perspective, I kept some figures here. So uh, there were about like reported until yesterday, I mean the 18th of March, 81,163 cases were reported in China. Now, they were the people who showed symptoms. Now, there are several stages. The actual number of people who were infected in China, nobody knows. And even government doesn't know, but we all can presume they must be in millions. And out of these 81,163, so 3,242 died. So if we take the denominator as 81,163, then the figure mortality comes to like 3.99%. But if we consider the real infected number of people in millions, then this mortality could be minuscule. Likewise, in US also, like 6,427 people reported, and 4,558 tested, and 108 mortality. Now, the real people who are infected in US could be again in millions, but since their testing was not done enough in the beginning of the epidemic, so but still taking like the figure of 6,427, the mortality comes to 1.68%, which is about like 7.7 cases a day. For a comparison purposes, if you see, like there are millions of people get sick from influenza and pneumonia, and 45 million deaths happen because of that every year. So these are the figures of 2017. So 55,672 deaths over a period of 1 year. So that comes to like 150 deaths per day. If we consider the season to be only like 4 or 5 months, then the figure will become like almost like 600 deaths per day only for the season, as compared to like 7.7 deaths per day in the last 2 weeks in USA alone. And these are the figures coming from CDC. These are the annual rate of infection, like the people who get sick and people who get hospitalized, and then the people who actually die. These are the data, and if you can see, like the symptomatic illness could be in millions, and the people who died like 51,000. This was 2014 2015. The figures for 2017 2018 was like 61,000. So again, coming back to the relative perspective, so it's almost like 152 deaths per day if we spread those deaths over a year. but it could be really like 600 deaths per day, as compared to that like 7.7 deaths per day for this COVID-19. So we can easily say like this COVID-19 is a different form of just flu, and there is a lot of hype being created by it because China wanted it that way, and the China presented it for their own population. But reality speaks like totally different. Uh, Now the real scare in US started. This is around 13th and 14th last weekend, when the policymakers in USA, they started comparing the epidemic uh, happening in Korea, and they compared it with the cases in Italy. So just to give a little glimpse of like what is happening both these countries, Korea and Italy, they are the same environmental characteristics, population size kind of similar, 51 million in Korea and 60 million in Italy. The stark difference comes in Korea, the population over 60 is like 20.3% only, while in Italy is much older population, 27.8%. And the other big difference is like this is the number of smokers in Korea and Italy. The like only like 3.5% of women in Korea they smoke, while more than 38% of men they smoke, while in Italy it is like a more 15% women who smoke and 25% male who smoke. So as per the figures that came from Korea and Italy, in we can say like in Korea more of 60-year-old women they contracted it, and they were like non-smokers, and as a result they recovered well from it, and very low mortality. On the contrary, like in Italy, the more of 70 years old or more, like those male and female were affected, and their health was like much poorer than the health of like non-smoker women of like Korea. And some of those people who died, so mortality figures came to about 8%. And immediately the policymakers in USA, they started extrapolating the figures for US and Canada, and they started like closing down international flights, stop eating out, and stop working in offices. Now, in other words, like it's United States president started imposing economic sanctions on the American people themselves. Like the USA has been imposing these economic sanctions of various countries like Venezuela, Iran, other places. But now this is the instance where president is imposing sanctions on American people themselves, and this is like totally unacceptable thing to all of us. And as a result, Canada is coming out with its own sanctions. Europe is like bringing their own sanctions. Trillions and trillions of dollars are getting like lost in the process. Now, a few summary points that come out of this all happening is because there's a complete like a media onslaught going on, and I want to give a glimpse of this. This was the I heard this video yesterday on the 18th of March. This Bill Ackman, this is like a activist investor, and he gave a very emotional speech that as if like a doomsday scenario is happening, and all the like people and millions of people in USA will die. He is not a medical person, he is not an epidemiologist, he's just an investor. He has his vested interest in the market. Who knows, he was trying to create a panic so that more selling occurs and the more he can buy stocks much cheaper. Or I don't know like what his purpose was, but people like him should not have been given any amount of airtime what CNBC did. And this is like a almost like a criminal thing happening in USA, that these channels, they are giving like rabid broadcasts of people and trying to create a scaremongering, and trying to, and the most disturbing aspect is like based on the CNBC and like their presentations, American president President Trump is listening to them, and he is instructing and like having an expectation that the Fed will dole out their trillions, and the Ministry of Finance like they will also dole out like trillions and make people get out of their jobs, stay home, restaurants closed, all services closed, flights closed, and it's like a total shutdown of the country, which is causing like huge setback for the country. So I mean, just to give like few summary points forward, I want to bring to your attention to the fact that testing has a value only in the early stages of the epidemic. In the later stages of epidemic, it has no utility at all. The hype created in last week in USA by these so-called epidemiologists was that as if we have done some crime that those testing was not done. Of course, that testing would have been better if it was done in the early stages, but now it is already late and millions of people are already infected. It has no meaning. So that is regarding the testing. Now there is a media onslaught going on also regarding, okay, make a vaccine, make the like the treatment focus, basically bring out with a medicine that can cure this thing. But really speaking, the real treatment of any viral illness, including this COVID-19, is the person's own immunity. The people, when they contract it, 98.3% people who walked out, like who were infected, but they walked out without any death or any consequence. So their body developed their own antibodies, and then they came out of it no problem. Even for the people who are admitted in the hospitals across the world, in China, Korea, Italy, wherever, the only treatment in the hospital is like supportive care, basically some steroids, some IV fluids, just make them breathe, respirators. But the real treatment happens when their own bodies, they develop antibodies, and then they slowly recover from it. I want to bring your attention to this paper that we saw. Like this is the only paper that came out of China. This is a fairly new. This came out just on the 9th of March. As you can see here, 9th of March and was published in Lancet. So 191 patients were admitted to the Wuhan hospital. 137 patients came out of it, like they were discharged from the hospital in a couple of days. That gives a figure of like 71.7%, and only like 58 people died from the illnesses. That's like 28.3%. So again, coming back to the mortality, like, so I want to bring back to this slide. So 98, like if we take the figure of 1.68 here, but if the denominator is in millions, that the real scenario is, then almost like 98.7% of people got out of it without any death consequence. So the scenario is same for like flu also, that millions of people, they just get the disease but they come out of it. What I want to say here is like, so self-immunity is the only savior from this thing. Now one important aspect is like when millions of people get exposed to the virus and they get out of the wave quickly, their plasma is rich with antibodies and then easily can be used to save the life of seniors. Millions of units of these antibodies rich plasma will be available in less than a week, rather than any vaccine that could be more than 1 year away. Big Pharma, or these so-called epidemiologists of USA and CDC and Dr. Fauci, and like you call them different names, but they are not telling the president about this fact that big, and because there's no pharmaceutical benefit coming out to the big pharma. But this is a fact that when people come out of COVID-19, their plasma is like rich in antibodies, and that could be used to save the life of the few seniors who will get admitted to the hospital, and then we can save their lives. So real self immunity from this virus is the only important thing. So we still have to observe like social distancing and personal hygiene and frequent hand wash kind of a techniques. That is totally acceptable. That doesn't impair our businesses. In China, since the epidemic has died down, like, and or they are reporting it to be died down, they have asked their officials to go out and eat in the restaurants. As on now, as on 18th of March of 2020, they're asking their officials and the government people to go out, eat in the restaurants, do shopping. The country is open back to like normal. While in USA, we are harping on things which are not supported by any kind of evidence. So in nutshell, what I can say, like, we the people of Canada and USA must stop this media hype and save our country from these rabid decisions of stopping work and stopping travel and stopping the life of people. We cannot allow President of the United States to take a decision to put economic sanctions on American people. Thank you very much.